Hello everyone, welcome to Pathologue, a clinico-pathologic dialogue between a pathologist and a surgeon. I'm Dr. Srikant from Oral Pathology, and with me today I have Dr. Jefferson from Oral Surgery. So let us begin with Dr. Jefferson. Why does a patient come to you for removal of a tooth?
Good afternoon, Dr. Srikant. A patient comes for a removal of a tooth or Exodontia as it is called for multiple reasons. He can come when the tooth is grossly decayed, or when there is a mobile tooth beyond a particular point, when there is an unrestorable tooth, a retained tooth, maybe a milk tooth or a deciduous tooth which is retained, or an extra tooth like a supernumerary, or for orthodontic purposes for proper alignment of the remaining tooth.
Alright, in pathology we talk about the importance of clot. It acts as a scaffold and you should not allow the clot to get dislodged. So what are the instructions that you generally give the patient so that the clot is held on its place?
The most important thing after extraction of a tooth is the clot formation, because that ensures the healing of the socket. The important things for this are the instructions which we have to give for the patient. Normally we place a pressure pack, a wet gauze which is made into a ball, and it is kept on the socket to apply pressure to the socket. It is kept for a period of 30 minutes, and during that period the patient is asked to avoid any sort of disturbance to the clot. So this is the first instructions which are given to the patient.
Alright, I see that you are giving an instruction of a wet gauze being placed for 30 minutes, but we know that the bleeding and the clotting time ranges from 5 to 10 minutes. So why this extended period of compression using a wet gauze?
For the clot formation to happen, there is the coagulation cascade as you would have read, but there is a fibrin stabilizing factor which plays an important role in the clot formation to happen. So the time period required for this fibrin stabilizing factor to exert its influence is 30 minutes. So even if the clotting is for a period of 10 minutes, we need this 30 minutes for the fibrin stabilizing factor to exert its influence to have a proper initial clot. That's why the period is 30 minutes.
And why the importance of the wet gauze? Why not just place a piece of dry gauze?
Sometimes the fibers of the gauze itself can get entangled in the clot, and when we are removing it after a period of 30 minutes, the clot can dislodge along with the gauze. So a wet gauze is placed so that it doesn't get entangled with the healing or the forming of the clot.
Alright, I also paid attention to the fact that you should not allow negative pressure. So what is the importance and what do you mean by negative pressure?
A negative pressure is anything in which inside the oral cavity we have a negative pressure form due to any of the actions that is being done by the patient. For example, spitting or using a straw. In these cases, a sort of a pressure is applied which can cause the clot to dislodge from the socket and thereby impairing the wound healing. That's why negative pressure has to be avoided post-extraction.
Very true, very true. So, God forbid, if something happens and the clot does get dislodged, what potential complications are you looking at?
The complications are impaired wound healing, obviously, because when there is no clot, the wound doesn't heal. And if it is just left like that for a period of time, it can even cause dry socket. Though it is another clinical entity, dislodged clot can lead to a dry socket, which is a very uncomfortable postoperative complication for a patient.
Other than dry socket, are there any other complications that you are looking at during or after the process of extraction?
Yes, during the procedure itself, we can have a fracture of the tooth, a fracture of the root. You can injure the soft tissue around the tooth. You can injure the tooth which are adjacent to the extraction tooth in question. We can extract the wrong tooth. We can injure the bone which is around the tooth. So basically anything in and around the tooth can be damaged. So these are the complications which can arise during the extraction procedure. So it is important to know the right way to do the extraction to avoid these complications.
Alright, Dr. Jefferson, but I would like to know, pathologically the whole process is a long way, because within the first week the primary epithelialization takes place, fibrin gets converted into a granulation tissue, the granulation tissue takes time for the osteoid to develop and bone to develop. So it's a long process. So how long do you follow up the patient and when does the bone change actually become visible to you?
The mucosal healing, the soft tissue healing, the initial healing takes place within a time of 7 to 10 days. Okay, approximately a week's time. But the bone takes 6 to 8 weeks for the healing to happen. So radiologically, if you want to see also, it takes that much time. And for the whole wound to mature and heal and become like a normal tissue, it takes a period of 3 months time. That being said, an initial healing of 1 week is good enough for the patient to continue their normal activities.
All right, Dr. Jefferson, it was a very insightful discussion on exodontia. We shall have another dialogue on dry socket in the next session. Thank you.
Thank you, Dr. Srikant.